Hello everyone, my name is Amie Cockrell and I'm here to discuss the article Gender Differences in Emotion Recognition, Impact of Sensory Modality and Emotional Category by Lena Lambrick, Benjamin Kreifelds, and Dirk Weilgruber. It's a 2014 quantitative study published in the Journal of Cognition and Emotion. The purpose of this study was to investigate gender differences in recognition of performance across different sensory modalities and across a range of emotions. Sensory modalities included audio only, visual only, and audiovisual combined. The study was conducted in Germany with 40 males and 44 females, ranging in ages from 20 to 70 years old. Each subject was screened and assessed to exclude a history of neurological or psychiatric illness and visual and auditory impairments that might bias results. Experimental design for the research included the use of an electronic screen and headphones. Participants were seated in a comfortable position and placed approximately 28 inches in front of the screen in a distraction-limiting environment. 5 emotional categories, including happy, alluring, angry, disgusted, and neutral, were displayed on the screen for 1 second, and then the participants were given a stimulus, either an audio clip, a black and white still picture of a facial expression, or both were presented. The participants then had up to 10 seconds to respond with the emotional category that best fit the stimulus presented. Each participant was presented with 240 different stimuli administered in 2 separate rounds. Through this methodology, researchers found that there were significant gender differences in auditory stimuli, and women overall displayed the tendency to more accurately recognize auditory emotions. Overall, it was also discovered that both genders were better at recognizing emotions from facial expressions rather than vocal cues when presented with only one stimulus at a time. However, bimodal stimulus, meaning both audio and visual stimulus presented together, produced the most results accurately. Strengths of the study included the ability for researchers to isolate genders, types of emotions, and study each separate. It also accounted for any bias related to the current mood of the participants or their own perceptions of emotional intelligence. The study could also have been enhanced by using more participants varied across more diverse cultures and geographic locations. So how might this study be applicable to the healthcare industry? Are you surprised by the results? So a few thought-provoking concluding comments. In thinking about the growth of telemedicine, how can we use these results to develop a program that provides the highest quality of care and communication methods for patients and providers? If women are better at identifying emotions based only on auditory cues, how might this affect phone communication with patients? Thinking about patient care environments, computer screens, alarming monitors, what distractions might exist that are barriers to being engaged in emotionally identifying stimuli, audio, visual, or both? And what might this effect have on our ability to pick up on a patient's nonverbal emotions? And finally, what are the consequences of not being receptive to emotional stimuli or interpreting these stimuli inaccurately or maybe not at all? Thank you for being a part of this discussion. I look forward to your comments to follow.